This is a point-of-care ProTime analyzer. They're becoming much more common, especially in doctors' offices and visiting nursing programs. They're basically are a cartridge which measures how long it takes the blood to get through the little capillary space, and when the capillary space is clogged up, then the ProTime is done. So all of your reagents and everything are contained within this little cartridge. You don't open it and start to use it until you're actually ready to test the patient. Because this is done from a finger stick, I'm not so concerned about labeling it at this point, but we do have to make sure that we properly identify our patient. So I've checked and I'm still me. So here we go. We're going to turn this on, and it's going to do a little bit of a self-check. It's going to tell us what the battery life is, and then it's going to give us idiot instructions. All you have to do is do what it tells you. It says to insert the cuvette, and then you're just going to follow the steps one by one. I'm going to get everything ready for my finger stick so that I can get this going quickly, because once you start it, you only have about 2 minutes to complete the entire procedure. So we're going to need an alcohol swab, and if I were doing this on somebody else, I of course would be wearing gloves, but can't stick myself through gloves. So what we're going to do is we're going to follow the instructions. It says insert cuvette. I want to make sure that I can read the word ProTime. The little well has to be sitting up, and I'm just going to insert it into the slot, and you have to push pretty firmly to make sure it's all the way in. The instrument will tell you it's warming, please wait. And so when it tells you to wait, you wait. It doesn't take long. You can alcohol the finger that you're going to be using, just like with any other dermal puncture. You're going to want to use the non-dominant hand, and you're going to want to go to the side. This little tenderlet comes with the instrument, and this is the one you're going to want to use. You're going to have to push this red lever to make the blade come out, and you have to push pretty hard. Then once you've pushed this, you're going to hook it in here and collect the blood in here. Now that it's warmed up, it tells you incise the finger, apply the blood, and press the button. You've got 2 minutes to do this. Once you've got it bleeding, you've got to get this snapped into place, and you've really got to be bleeding because you want this dripping into the cup. If it starts to clot before you're done, the test won't work. And you have to fill it to at least the first mark. Then you push the round button or the oval button. It then tells you to remove the tenderlet, that's this. So you snap this loose. And the testing doesn't take very long, just a few seconds. Unfortunately, it tells me that my sample is too small. I need to turn it off and try again. But those are the steps we're going to use. You need to make sure everything is warmed up before you start, and I'm wondering if maybe our test cartridge wasn't a little too cold. So we'll give it another try.